So this presentation is just an introduction, kind of an overview of what the screening is all about, and that's diabetes, blood pressure, and kidney health checks and care. The goal of the screening is to work together to keep kidneys healthy, prevent or delay dialysis, really making a plan on how to keep kidneys healthy. 1 in 10 Canadians has kidney problems. Almost 1 in 3 First Nations adults have kidney problems. Diabetes and high blood pressure are the leading causes, but not the only causes. And we're just seeing a lot more kidney failure and use of dialysis over the last 20 years. So that's why we have developed the Kidney Check project that is bringing kidney diabetes and blood pressure testing to rural and remote Indigenous communities. It involves mobile healthcare teams who actually do the testing and provide on-the-spot results. So people get their results right away, a kidney health plan is created, and follow-up care is arranged. So it's important because people may not know that they have kidney problems, and the earlier we find them, the better. So this screening is under an hour. It allows teams to find kidney problems early, to find and provide care for risk factors like diabetes or high blood pressure, and we can make a plan to keep kidneys working into the future and prevent or delay dialysis. Communities are involved, first leadership, and then talking to the broader community, then actually having the health checks, doing the follow-up care, and then eventually coming back to the community to check in again to talk about the results overall and the experience of the community in the screening. The screening uses a First Nations model of care. There's Indigenous patients as partners on the initiative. Also, communities are partners on the initiative. The testing process runs from registration and consent to getting blood pressure, doing that finger poke for blood, a urine test, entering all the information, getting the results, and then making a kidney health plan. Consent, it's just agreeing to go through the screening and having everything explained to you. Being registered, which might vary a little bit depending on the province. Look at your height and weight. There's testing equipment used on site, and this is how we get your results right away. So it'll be under an hour, about 15 minutes to register and get consent, 15 minutes of the actual testing, and then 15 minutes of going over all the results. The results are going to show your chance of kidney failure or kidney problems in 5 years. And this is so we can make a plan now and change that. That's the goal. So you might come up as no current risk, low risk, intermediate risk, or high risk. And then we know what kind of treatment you're going to need so we can change what those outcomes are going to be in 5 years. We want to keep people's kidneys healthy or treat any problems that they're having right now. So depending on what your results are, you're going to have different people involved in your follow-up care, anywhere from primary care to kidney healthcare teams and a kidney doctor. So some of the treatments might be, looking at lifestyle, foods and activity, making sure there's a healthy blood pressure, diabetes is being managed, there might be medicine or medications. So the whole goal is to know where you're at right now so that we can change that outcome in the future. So if you're at an intermediate or a low risk now, we want to try to have kidney health care done so that you would be in a lower risk category. So that's the whole goal, is to really start treatment now before you lose kidney function so that we can really level off and make sure that you don't lose more function. And even if you have a loss of kidney function right now, even if you start treatment, you're still going to have a lot longer period of time before any kind of kidney failure happens. It's when we get into a significant loss of kidney function, then you're going to be closer to failure and dialysis. But we can still hold it off for a little bit. But ideally, we want to know how you're doing now and start treatment now. So do not pee before the appointment because you're going to have to pee there. Bring your health card, avoid smoking, and bring any questions you have. Kids can get screened. They just need consent from a parent or guardian, and it depends on the province. It's really important to know how your kidneys are doing now and to get checked every year at least to make sure that your kidneys stay healthy.